Greetings and welcome to the Cancer Interviews podcast. Thanks for being with us. I'm your host, Bruce Morton. Our guest is Nancy Torrison of Minnetonka, Minnesota. She is the executive director of the A Breath of Hope Lung Foundation, and she's going to educate us about the many pieces of a lung cancer journey. So here she is, Nancy Torrison. And Nancy, welcome to Cancer Interviews.
Thank you, Bruce. Glad to be here.
And the first thing we want to do, Nancy, is learn a little bit more about you and what you do with the A Breath of Hope Lung Foundation. So if you would just please explain to us the chain of events that led to you becoming executive director of the foundation.
Okay, well, so I started my career in corporate America and was an executive in corporate America. I took a few years off to raise my 4 children. And when I came back in, I stepped into the nonprofit world and pretty much wore every hat in the nonprofit world. So I did PR, I did marketing and communications, I did fundraising and finance. And when this organization was looking for their first executive director back in 2012, I actually got recruited by one of their board members for this position. So I made a change at that time and moved over to A Breath of Hope Lung Foundation. That was in November of 2012 and been here ever since. And when I came in, the organization was still in startup stage. So they were an organization that did not yet have programs, but they had a really clear-cut mission with 3 very distinct goals for fighting lung cancer. And so that's where I stepped in and then developed the programming and the brand from there.
And we're going to talk about that 3-pronged approach a little bit later, but I would guess from a distance, it sounds like what you do is very fulfilling.
I love it. I actually lost my aunt to lung cancer a couple decades ago now, but she happened to be a smoker. And I know now that lots of non-smokers lose their lives to lung cancer, but she happened to be a smoker. And when I was sitting with her in hospice, one of her final days before she was unconscious, she told me that she deserved to die because she had been a smoker and she couldn't beat the habit. And I remember arguing with her that she was just this beautiful light in the world. And she was still pretty young in her 70s. And I just remember arguing with her that she didn't deserve to die because she had this one habit. And so it always stuck with me. And so when this organization came and asked me to consider being their executive director, I actually had 2 other job offers, and I could not get this lung cancer out from under my skin. It had already just really embedded itself in my psyche. And I was still mad about what Marcella said to me on her deathbed and the way that the world really views smokers. And unfortunately, the way that the world views lung cancer patients, whether they smoked or not. So.
Nancy, that is a nice segue, although the circumstances were not nice. That is a segue that leads into one of the many things I wanted to talk about that are part of the lung cancer equation, and that is the stigma you referenced. How inaccurate is it, if there's a way to quantify it, how inaccurate is it, and what kind of damage does it do emotionally or in a collective sort of way for the lung cancer fight?
So that's, I think, the most important thing you could ask today, Bruce, because really the stigma, it is inaccurate, but it's also really unkind. And I think that being a person that grew up when we really understood that smoking is unhealthy, it's an unhealthy habit, that started in the 60s and 70s. And so when I was growing up through the 70s, and I was being taught that almost like there was a lot of blame assigned to smokers rather than just looking at the tobacco companies that are targeting people and communities and children and things like that. So I think I was part of seeing what happened when we understood that smoking isn't good for our health, but I think we did it wrong in our country. I think we created a stigma that attached itself really unfortunately to lung cancer patients. So the stigma that, it's a smoker's disease, first of all, that's inaccurate because we have more than half of the people that are diagnosed each year are non-smokers when they're diagnosed. It's considered 50 to 60% of people that are diagnosed with lung cancer are non-smokers when they're diagnosed. So some used to smoke, but a lot of them smoked a long time ago, and some never smoked. The figure that we like to use is around 20% are never smokers. Another 30 to 35% are former smokers, some of them having smoked really when they were younger and not for a very long time. So when we talk about, everybody's saying that lung cancer is a smoker's cancer, it's just inaccurate. But the rest of it is that there's not just a stigma that is inaccurate. There's also a very, very unkind innuendo that our lung cancer patients hear all the time, whether they smoked or not. They always get the question, and it doesn't happen with other diseases. They always get the question, well, did you smoke? And it's the way that it's said. There's an implication that somehow they deserve to be sick and they deserve to die because they had this habit. So I think that what we're trying to do as an organization, I think lung cancer organizations are trying to do this across the country, is undo that stigma that came about when we were teaching people to quit smoking and just look at it differently, because lung cancer is just like other cancers. Anybody can get it. And it's true that the number one cause is smoking and secondhand smoke, but anybody can get lung cancer. If you have lungs, you can get lung cancer. And until the world and our country understands that, there's going to be a really hard time. We're going to have a very difficult time really diagnosing non-smokers, and which is what's happening right now. So
now, if you like what you hear in this segment, we invite you to subscribe to our podcast by clicking the links below. Once there, you'll see a bell icon. If you click on that, we will notify you when we post a new interview. Nancy, I did want to mention that there are some symptoms of lung cancer that seem so disparate, that seem so unrelated to lung cancer, but they are things that perhaps should get your attention and have a doctor look at it. What are some of those things that can tip one off that they may be a candidate for lung cancer?
So whether you are or are not a candidate for lung cancer, so whether you do or do not feel you have risk factors, and I guess I'm speaking about what America knows, which is smokers versus non-smokers, anybody can get lung cancer, and it happens to everybody, and whether they smoked or didn't smoke. So I think that what you really have to be thinking about is understanding the symptoms is important to your health and your family's health. So is understanding the symptoms, is it understanding the common symptoms, or is it understanding the uncommon symptoms? It doesn't really matter. You have to advocate for yourself right now, because non-smoker after non-smoker that comes into our office, their symptoms were misdiagnosed and missed. And so when you, I'm sorry about my bangs. And so when you are talking to somebody that's been diagnosed with lung cancer, a lot of them didn't have any really noticeable lung cancer symptoms or any kind of symptoms, really, because that is the type of disease that it can be asymptomatic. But a lot of people did have symptoms. They had shortness of breath. They had a cough that wouldn't go away. They had a little blood when they coughed. They had sore shoulders, sore joints. There's just some unusual symptoms that a lot of people that have lung cancer have named after they get diagnosed with lung cancer. Unfortunately, the common symptoms of lung cancer really mimic asthma and they mimic bronchitis. So quite often, especially for the non-smoker, when they go in with these symptoms, they'll be diagnosed with something other than lung cancer, and they won't be checked for lung cancer. And that, can go on for months, which, I guess the longer you go without diagnosing a cancer, the more time it has to grow. So I think people have to advocate for themselves. They have to know things like severe fatigue. That's not something that you should overlook. If you've been really tired and you can't explain it, and all of a sudden you've been really tired for, weeks, that's a symptom of cancer. And it's a symptom of a lot of other things too, but you just have to be persistent in pursuing your physician and pursuing tests. And the low dose CT scan is what we recommend for lung cancer diagnosis. And if you are a smoker, and especially if you've been a heavy smoker at any point in your life in the last 15, 20 years, you do need to pursue a low dose CT scan if you have any of these symptoms that last more than 2 to 4 weeks. We just don't like to hear that people have had their symptoms for 6, 9, 12 months. As a matter of fact, a good story to share is our board chair, Julie Opheim's mom, She was a healthy young woman and had a smoking habit. No, I'm sorry. She never smoked. So she was not a smoker, but she went in, she had this severe fatigue. She had little reasons where you might, consider lung cancer, but she had some shortness of breath, but they actually diagnosed her with depression. And for several months, she was thought to be depressed. And that was why she had this fatigue and she had some of these other symptoms. And when they finally pursued it, because her symptoms got worse, when they finally pursued it, it turned out that she had stage 4 lung cancer and she died not too long after that. So she was, really completely misdiagnosed. And so we hear stories like that a lot at our foundation. And so we just really want to encourage people that, if you have symptoms that last more than a couple weeks, more than 2 to 4 weeks, really you need to dig deeper. And you need to advocate for yourself and make sure that everybody's thinking about your whole body and your lungs. So
Nancy, you had mentioned the CT scan, but we should not confuse that with a lung cancer screening. Is a lung cancer screening still the gold standard in terms of diagnosis?
So it's really important to understand the difference between preventative screening and a scan. All of the research that's been done recently shows that the chest X-ray isn't the right test to do if you suspect lung cancer. The right test to do is the low-dose CT scan. And the low-dose CT scan is the gold standard for preventative lung cancer screening. But it's important to understand that preventative screening, like with any other cancer, means you have no symptoms. You aren't sick. You are just a candidate, or you have some risk factors for a cancer. And so you get screened because you don't have any symptoms. Now, if you have symptoms like a cough, or you're spitting up blood, or you have some of these other symptoms we've discussed, then it becomes a low-dose CT scan. It becomes a scan versus a screen. And it's just a different process, and it's a different way of coding it within the medical system. But it's important to note the difference, because screening is always for people that are not experiencing symptoms. And unfortunately, I know you talk to a lot of people with a lot of different kinds of cancers. Unfortunately, in the cancer world, in the lung cancer world, the only people that can receive preventative screening, and I mean the only people, are people with heavy smoking histories, 20-pack smoking history within the last 15 years, and they're over the age of 50. Now, those are recently expanded guidelines from the USPSTF, and we're thrilled that the guidelines were expanded. Almost everybody I meet does not fit those guidelines, and they would never be eligible for lung cancer screening. So they basically have to wait till they have symptoms to receive a low-dose CT scan. And I'm talking about, this is eligibility that, if you let's just say, I can name a family right now that we work with all the time. Grandpa died of lung cancer. Dad died of lung cancer. This was a mixture of smokers and non-smokers in their family. Uncle died of lung cancer. Uncle's sister died of lung cancer. I mean, it's just like it's prevalent in their family. And again, it's non-smokers and smokers. As their generation now, that's in their 40s, 30s, 40s, 50s, they would like to be screened, but they're all non-smokers. They cannot be screened. They cannot pay for it. Their doctor has to refer them to a lung cancer screening program. And because they aren't over the age of 50 with a heavy smoking history, they are not currently eligible for lung cancer screening. So think to other cancers. Think about how colonoscopies work and how mammograms work, and prostate and ovarian. I mean, we are preventatively screened for a lot of cancers, but the world's deadliest cancer, lung cancer, does not have a screening tool that is available to everybody. It's only available to, again, those heavier smokers over the age of 50. And if those people that are over the age of 50 and have that smoking history and who are eligible for screening right now would get screened, we'd save tens of thousands of lives every year. But unfortunately, it's thought that about maybe 8-10% of those people that are eligible right now are actually choosing or being identified to be screened. So even though we have a screening tool for a certain small percentage of our lung cancer, what will be our lung cancer population, they are not getting screened. So we have a lot of problems in this field. We have a problem with uptake for those who are eligible. And we have a problem with our guidelines and our tool, which is the low dose CT scan, being very limited and only available to a small percentage of the people who will, get lung cancer in the next 5 to 10 years.
Nancy, I'm asking you to look into your lung cancer crystal ball here, but can you foresee a time in your lifetime and my lifetime in which the screening parameters might be expanded so it is easier for more people to get screened?
So I feel really good about it right now because it was just recently in the last 6 months that the USPSTF expanded their guidelines from age 55 to age 50 and from a 30-pack history to a 20-pack history. So the work that we're doing collectively as lung cancer organizations in the country is working. Right there, we're saving lives if we can get those people that are now eligible to choose to be screened. So I feel good about it. I feel like we're moving in the right direction. I think the low dose CT scan is thought to have enough risks that they'll never offer it to the general population like we do with the mammogram. And I don't agree with that personally, but I'm also not a doctor. So I think that what we will find is that blood-based screening and other kinds of early detection tools will become more prevalent in the US. And I know a lot of those are in the works right now. Some of them are in clinical trials right now. So I do think that more attention is being paid to lung cancer than has been paid to it in the past. I think people are waking up to the fact that it's not just a smoker's disease. And I think that as we crush the stigma and sort of re-educate America about this disease, I think that we'll see more interest and more attention and more funding on finding a good preventative screening tool.
Nancy, here's another piece to the lung cancer equation, and it is something that exists where you live in Minnesota. It exists where I live in Colorado. I'm not sure that it exists everywhere in this country or everywhere on Earth, but a contributor to lung cancer is radon and its presence in one's home. First of all, just educate us, if you would. What is it, and what can one do to keep it from being a cause of lung cancer?
Yeah, so that is so important, Bruce. That's such an important question. And here in Minnesota, we have very high rates of radon in our soils. And there's a lot of states. I think radon is everywhere, but I think certain states have just a higher presence of radon in their soil. So here's what's really sad about this. It's believed that radon is the #1 cause of lung cancer in non-smokers. And what's sad about that is that radon tests, radon is it's a gas that's in the soil. There's nothing you can do about it. It seeps up, new houses, old houses, doesn't matter. It seeps up through the soil. It looks for cracks and crevices, and it gets into people's homes, starting in the lower levels. And again, it doesn't matter if your home is new or old. It is able to get in eventually. And I think radon, you can't smell it. You can't see it. There's no way to know if you have radon in your house or in your school or in your church unless you actually test for it. And here's the thing that's really sad. The test kits that are very accurate are $10. And they're sold all over the country in hardware stores and lumber yards. They're just radon detection sites. And I'm just going to admit that the first time I did mine in my house, I screwed it up and I did it wrong. I didn't follow the directions. So, but they're pretty simple to use. You buy the kit, you rip it open, you tack it up to a wall somewhere in a kind of a heavier, a part of your house that's on the lower level, but it's maybe a family room where your family uses it. And you just let it hang there on the wall for 3 or 4 days. And then you package it back up and you mail it off to a lab. And then the lab will post your results, a week to 10 days later. And if you're getting readings of over 4 or higher, you really need to talk to a radon expert at that point and consider having your house mitigated and getting the radon just removed from your house, which is a simple system. It's actually kind of expensive, which is a deterrent. It can be a couple $1,000s. I think they start at maybe $1,300 in Minnesota and they go up from there depending on the size of your house. But They just put in kind of a fan system that pulls the radon out of the house and blows it to the outside of the house. So it's just I almost think of it as an air exchange system that they add to your house. Sadly, I just had to do this recently. We've been living in a new house for the past 2 years, and about a year ago, I finally tested the house for radon. I'm so embarrassed that I waited for a year. And the levels that came back were 12 to 15, which is actually pretty dangerous. And this is long-term exposure, so I still feel okay about it. But I called a mitigation company, and they came out and got the same readings that I did with my little $10 kit. And then we paid them to do a mitigation, and now our house has levels. It still has some radon in it, which is surprising, but the levels are down like at 1.5 or 2, which is considered mostly safe. So so I just would encourage your listeners to go out and buy a $10 kit, hang it up in your lower level. I ended up buying a long-term radon monitoring device that cost a couple $100, and I've moved it around my house. But you really just need to test your lower level. If you have it on your lower level, you have it on your other levels. It just gets less concentrated as it moves up. So I just would really encourage people it's just an easy prevention method to prevent, lung cancer, especially in non-smokers. And I have 2 women that work for us, both with stage 4 lung cancer, both never smokers, both diagnosed. I think one was diagnosed around 41 and one was diagnosed around 49, and both found radon in their houses after they'd been diagnosed with stage 4 lung cancer. So I just really, really encourage people to take that simple step. Just check your house once a year and buy your $10 kit, and just make sure your family isn't breathing radon every day.
Our guest is Nancy Torrison of Minnetonka, Minnesota. She is the executive director of the A Breath of Hope Lung Foundation, which is based in the Twin Cities. Now, Nancy, I want to move on to a part of this equation that deals with people who have been diagnosed. And there could be, for lack of a better word, some potential obstacles that one can encounter when dealing with providers of health insurance. If so, and I'm guessing there are, what are those obstacles, and what can the well-educated consumer, for lack of a better word, what can they do?
So I think that the most important thing I could say to a newly diagnosed lung cancer patient, first of all, visit youandlungcancer.com and really educate yourself about your diagnosis. youandlungcancer.com was developed so that any age level, any educational level can understand their diagnosis and understand how to participate in decisions about their care. So there's 2 things I would recommend to a newly diagnosed patient. Educate yourself, because there are study after study that shows that the educated and well-informed patient lives longer and lives better. And so you need to be somebody that educates yourself to the best of your ability. There's a lot of resources out there. youandlungcancer.com is just one, but educate yourself. And the second thing I would say is make sure you ask about comprehensive biomarker testing. We have made, there's just been unbelievable advances in the past 5-10 years, and most of them around finding treatments and very precise therapies for people who have biomarkers. So when you are diagnosed with lung cancer, and again, I work with patients all the time and I hear the stories, and some of them are horror stories. When you're diagnosed with lung cancer, especially non-small cell lung cancer, you need to receive comprehensive biomarker testing, and you need to be patient and wait for the results of that test, because those tests, if they identify a biomarker, a mutation, there are beautiful therapies that have just come through the pipeline, come through the hopper here in the last 5 years, that are really, really successful in treating certain types of lung cancer. So that comprehensive biomarker testing, sadly, is not offered consistently across the country. It's not offered consistently from healthcare system to healthcare system. So we go and we educate patients and families to understand that when you get a lung cancer diagnosis, when you're past the shock and the grief and the loss, and you can start absorbing things again. Educate yourself. Know everything you can about your lung cancer, and make sure that you've received this comprehensive biomarker testing to find out if you have a mutation that could lead to a very, very precise medicine and treatment therapy that is specifically designed for your lung cancer. Again, I have two staff, two people that work for a Breath of Hope Lung Foundation that both of them had mutations that led them to treatments that, they were both given a year to live. And one of them's at 5 years and one of them's at 8 or 9 years now with stage 4 lung cancer. And so we just have to really make sure that testing takes place. And if you're in a facility that turns you down or doesn't offer it, you need to go someplace else.
Nancy, we're going to wrap things up now, or steer the interview in that direction, but I want to shine the light on the Breath of Hope Lung Foundation and what it does. And I'll divide this into to two groups, although you've partially addressed, I think, the answers for both lines of questions. But first of all, for those who have not been diagnosed, but they've learned they could be a candidate for lung cancer, what can the foundation do?
So I think that, the foundation really, we have a mission to fight lung cancer and to try to save lives and prevent the number of diagnoses that we see every year in this country. But more particularly, we want to, 70% of lung cancers are diagnosed in stage 3 or 4. It's a lot tougher to beat lung cancer when you're in stage 3 or 4 than it is to beat it when you're in stage 1. So a lot of the work we do is in the early detection, and that's a big problem in lung cancer. Again, because sometimes symptoms are subtle. Sometimes people are just refuse to recognize their symptoms. Sometimes their doctors miss their symptoms and think of it as something else, but there's a lot of reasons for this. The stigma is a big part of it. We need to start finding lung cancer earlier. If you think about breast cancer survival rate is over 90% now. Guess why? Because 65 to 70% of American women receive mammograms, and it's being found in early stages when it's still treatable. Now, the survival rate for lung cancer is under 21%. It's because we're finding it in stage 3 and 4. We need a lot of focus on early detection, and a lot of that has to do with removing the stigma. And then once we remove the stigma, the 3 program areas that a Breath of Hope focuses on, which is not unusual for a lung cancer organization, we focus on research, improve dollars for research. Why would there be 8 to 10 times more spending on breast cancer than there is on lung cancer when lung cancer kills almost twice as many women as breast cancer every year? Lung cancer, almost twice as many dying of lung cancer as breast cancer every year. Why would we not be spending dollar for dollar per cancer death more money on lung cancer? So that's a problem. We have to address that. There is a hole where there should be a lot more research funding. So Breath of Hope funds research, and we have a very, very competitive process. We think we're funding some of the best science in the world right now. Our competitive process starts with our brilliant local research committee. We've got about 12 physicians and some patient advocates in that group. And we also have a national advisory committee. All of that's on our website, on our research page. But I think that we have a competitive research program that funds some of the best research in the country. And the research that we fund is called translational research. And that is the research that's really, really important for patients, because translational research means that it should reach the patient within 5 years. So it's that science that happens right before the clinical trial. And we need more of that in the lung cancer space. So that's one of our 3 program areas. Lung cancer patients have some of the highest levels of anxiety and depression. Of course they do. They deal with a stigma. They deal with unkind comments. They have, in a lot of cases, a poor prognosis. Of course they do. So we need better support mechanisms and, just more non-judgmental, compassionate care for lung cancer patients that we've had in the past. And when you start working with hundreds of lung cancer patients every year and you start hearing their stories, they deal with some really cruel remarks and they're also fighting for their lives. And so one of our programs is our patient and family program. We try to overcome some of those barriers to make their journey a little bit less stressful. So we provide rides in Minnesota. We're going to be opening that program in Southwest Florida soon. We provide rides so that nobody refuses to go to treatment because they can't find a ride. We provide companionship visits to help lung cancer patients feel less isolated and talk to somebody else that's been through the cancer journey. We provide support groups for survivors so they can talk to each other, but our support groups are educational. So we always teach about an important topic at the beginning of the support group and then move into the smaller chat rooms. We even have grief support groups right now because 80% of our people are not making it through the lung cancer journey, and they leave a lot of devastated family members behind. So we have grief support groups as well. So that whole patient and family support group program is necessary because it's lung cancer, because of the stats I've mentioned. And then our third program area is education. And we educate patients at undlungcancer.com, and we educate patients through the Midwest Lung Cancer Summit, both just really important vehicles for making sure that we do our part in helping lung cancer patients absorb as much information as they can, relevant new information. It changes every year. It's a crazy field. So we make sure that at the Midwest Lung Cancer Summit in November, and then the ongoing support groups, and then also the undlungcancer.com, every patient, if they want to be really, really well informed, they can be. So I just really, really recommend that patients take that on themselves to educate themselves so that when they go to their next doctor's appointment, they understand what their doctor's saying and they participate in decisions about their treatment and their care. And then the rest of that education piece is just community awareness. This is a major public health issue in the US. Lung cancer is, I think, the number one public health issue. I think it just is right up there with COVID right now. And it's because we don't have preventative screening tools, and we don't have a population that understands that even if you quit smoking 20 years ago, you can still get lung cancer. Even if you never smoked, you can get lung cancer. I mean, this is a public health issue when your community and your society does not understand that they are at risk for this disease. So a lot of what we do is events and community gatherings and public speaking and marketing campaigns where we push materials out across the US. And the other lung cancer organizations do this as well. It's really important to re-educate America so that we as a people understand that anybody can get lung cancer. If you have lungs, you can have lung cancer. You need to pay attention.
Nancy, I was going to ask about what the foundation does for those who have been diagnosed, but I think you've covered that pretty well. So I'll make my second question for you about something else. In these internet and Zoom-driven times, it enables people from distant locales to communicate with each other like you and I are right now. I suspect when the foundation started, it was serving mostly people in the Twin Cities and or perhaps in other parts of the state of Minnesota. But now with the internet and Zoom and that sort of thing, does the foundation's reach go elsewhere? And if so, how?
That's such a great question, because all of us as nonprofits have had to really pivot during COVID. We did used to have physical support groups, believe it or not. I mean, it just seems so foreign now after going through a year and a half of COVID, but we had physical support groups. And so that limited our support groups to those that lived in the Twin Cities. When COVID came along, we opened them up and they became virtual Zoom meetings, and they're going great. We've got great attendance, and we've got people coming in from other parts of the country. So you're absolutely correct. We will never go to strictly physical meetings. The Midwest Lung Cancer Summit in November has always been just a physical meeting for people who live in Minnesota or want to drive into Minnesota for that meeting. And, we draw a couple hundred people. Well, it's now going to have a virtual component as well as a physical component. A lot of people do want to be face-to-face and talk with experts and talk with each other face-to-face, but there will also be a virtual component. So we have pivoted on a grand scale, and we've opened ourselves up to all of our patient and family programming. We've opened it up to anybody that wants to be part of it. Now, undlungcancer.com, which is our patient education site, that one went global in its first year back in 2017. We've had patients and caregivers and physicians using that site for the past almost 4 years. We've had 300,000 visits to that site from 35 countries. So that one was designed to be online. And what we had to do, along with our partners, Mechanisms in Medicine, is we just had to do audience generation globally. We had to just push it hard so that the English product was available to anybody that wanted it. And then we redesigned it in Spanish. So the initial unlungcancer.com program is also available at Usted y Cáncer de Pulmón at that same website, unlungcancer.com. So that program has been global for about 3-4 years now. Our research program has always been national. We take our applications and proposals, and whenever we have an RFP, they're open to anybody that's working for a U.S. research institution. So that one's always been a national program. And then our patient and family program has always been local until the pandemic. And now because of the online access, it's really available to anybody.
Nancy, that's a wealth of information you've provided. And I would think that if anything stands out above, if any piece that you've addressed during our conversation that stands out, I would think that in a word, it would be education.
Right. Nope, that's it. That is the way we're going to stop more people from getting late stage diagnoses. It's going to be awareness and education, and it's going to be expanding lung cancer screening with whatever tool works so that we can get more people screened for it. It's the world's #1 cancer killer. We need to be screening people for it, and we just have to be working really hard and spending the dollars that are necessary to find a tool or improve on the tool we're using now so that we can screen more people for lung cancer. Yeah.
She is Nancy Torrison of Minnetonka, Minnesota, the executive director of the Breath of Hope Lung Foundation. And Nancy, before we go, is there a web address that somebody can contact to learn more about the foundation?
Yeah, breathofhope.org is our website. And I think whether you're somebody that wants to learn about preventing lung cancer or somebody that already has lung cancer, breathofhope.org has a wealth of information to teach about lung cancer. And I think that's where I would direct people. And thank you, Bruce.
Nancy, thanks so much. We appreciate it. And that's going to wrap things up for this segment of Cancer Interviews. We hope what you heard can aid the cancer journey for you or for a loved one. So until next time, we'll see you on down the road.
Thanks for joining us today. For more information, please visit us online at cancerinterviews.com. We appreciate you tuning in, and we'll see you back here again next time on the Cancer Interviews Podcast.